Betta. That's the way you spell better when you're confident in knowing that trouble don't last always. Our song of the day, the Feel God song of the day, done for us by Pastor Charles Chenier, reminds us that things can only get better. It's available on all digital platforms wherever you buy your music. Welcome to A Soft Place to Fall. I'm your host, Kerwin Fielding. November is Pancreatic Cancer Awareness Month, a deadly disease. It's one of those diseases that's usually diagnosed late in the stages. Our guests today have formed a soft place to fall for those who are dealing with the disease and for loved ones who have lost someone to pancreatic cancer. We'll talk more about that in this episode of A Soft Place to Fall. We're here to guide you through and take you to that place of restoration, rejuvenation, and resilience. I'm going to go and change clothes. Well, that's what I do. But for now, here's how I'm feeling. The Spirit of God, the Master, is on me because God anointed me. He sent me to preach good news to the poor, heal the brokenhearted, announce freedom to all captives, pardon all prisoners. God sent me to announce the year of His grace, a celebration of God's destruction of our enemies, and to comfort all who mourn, to care for the needs of all who mourn in Zion, give them bouquets of roses instead of ashes, messages of joy instead of news of doom, a praising heart instead of a languid spirit, rename them oaks of righteousness planted by God to display His glory. They'll rebuild the old ruins, raise a new city out of the wreckage. They'll start over on the ruined cities, take the rubble left behind and make it new. You'll hire outsiders to herd your flocks and foreigners to work your fields, but you'll have the title Priest of God.
A soft place to fall.
Well, even in the midst of the pandemic, it seems that a lot of other diseases have gone unnoticed, unrecognized, untalked about, but they are still very prevalent. November is Pancreatic Cancer Awareness Month, and it's one of those diseases that's usually diagnosed and caught in its late stages, having a tendency to put the fear into a lot of people. Today, I am so excited to have as my special guest a young lady whose family started a wonderful foundation. We'll talk a little bit more about the difference between foundations and other things. So welcome to another edition of A Soft Place to Fall with my special guest, Veronica Howard Sizer.
Thank you.
Thank you for joining us. How are you this morning?
I am doing well, and thank you for having us here this morning.
Okay. I always, and it's kind of like a trick question.
Uh-oh.
Some may think, but it really isn't. And my question to all of my guests, the first question is always, how did you get here?
How did I get here?
And we'll compare answers.
Oh, okay. Well, I mean, the very straightforward answer is that I got here through my cousin, Anidra Wells.
Yes.
She is a very special cousin to us, first cousin. Her mother and my father, who is the namesake for this organization, are siblings.
Yes.
So that's how I got
Well, you got that
falling
correct.
on this
You got that correct. Because Anidra is our director, an incredible, wonderful spirit, and she orchestrates everything so wonderfully.
Great.
So let's talk a little bit about first. Let's talk about pancreatic cancer. A lot of people don't know a whole lot about it, and like I mentioned in the opening, it's one of those diseases that is usually diagnosed in its late stages. So tell us a little bit about that, and we understand that your father. Yes.
Yeah, back in 2006, my father was diagnosed with pancreatic cancer. And there are a few things that are important about that diagnosis that I have to mention, because I think that many people may miss some of the signs and symptoms of pancreatic cancer. Number one, pancreatic cancer is one of those cancers that if you do not catch early, the prognosis is very dim. And so early diagnosis, early recognition of the cancer is very, very important. Number two, there are very specific treatments for pancreatic cancer right now. They are limited. More research needs to be done in order to expand the livelihood and the likelihood of someone who get the diagnosis of pancreatic cancer, that they would live and live a long, happy life. So back to my father in 2006, he was feeling ill. He was tired all the time. He was complaining of pain in his back and in his stomach. My mom would always say that there are days that she would come home and he's in the bed, and she's like, he's never in the bed. My father was a farmer. He was active. He was in the country in Morganza, as I mentioned earlier to you before this conversation. So he loved the outdoors. He loved the farm. And so he was very, very active. And my mom and my dad were on different schedules. My mom worked during the daytime. She was a professor of nursing at Southern University. And my father was a production engineer at WBRZ. So even they worked different schedules. My mom would be at work during the day, and my dad would be at work in the evenings. So, for example, if she came home for lunch or something like that, and he's in the bed, that's unusual, you know. So it wasn't until my mom had to have a surgery, and she had to stay home, that she really got a chance to really look and pay attention. She's a nurse, right? And so she noticed that, you know, he was lethargic, that he, you know, was in the bed when he normally wouldn't be in the bed, and all of these things. She said, Elvin, you need to go to the doctor. They did go to the doctor, and the first thing the doctor said is, oh, okay, your numbers are high, you have diabetes. That's the answer. Okay, you know, and you have diabetes. So they took that diagnosis. A couple of his sisters had diabetes. Okay, it's in the family. You know, all of the quote-unquote boxes were checked off by the medical professionals, right? So he went through diabetes training, what he needs to do in order to live with diabetes. We can deal with this diagnosis. We'll just make sure that we try and control it as much as we can with medicine and other interventions. And then one day, my mom and my dad were outside. They were going someplace, and my mom looked at him and said, Elvin, you're jaundice. Another warning sign. Jaundice, yellowing of the eyes, yellowing of the skin. So right then, my mom got on the phone with another family member, Michael, who is a doctor, and told him, Elvin is jaundice. What do we need to do? Oh, wait a minute. You need to do this. You need to do that. So he immediately got on it, and that's when we got the diagnosis of pancreatic cancer. Of course, by then it was already stage 4. Had he not been misdiagnosed 2 or 3 months earlier, 3 or 4 months earlier, we would have caught that disease probably at a time when he could have had some of these interventions, some of the Whipple surgeries to remove the cancer and the like. But because he was misdiagnosed and treated for several months with diabetes without the doctors and the medical professionals realizing that it was pancreatic cancer, we could have had a better prognosis. So when he was diagnosed, he said, oh, okay, 6 months to live, go home, get your affairs in order. And that's generally what it is. That's generally what you would hear when someone would diagnose you with pancreatic cancer. And so my dad was like, my mom was like, we don't have to accept this. We're going to do what we can do. My dad lives 18 months later. He was a fighter. He fought the whole time, and he didn't leave this place until he was satisfied that his family was prepared to live a life without him.
So it's interesting because, of course, we did mention it's always confusing. The diagnosis usually comes back something else. And then once you have found out that diagnosis and he made that decision that we're going to fight this thing, we're going to fight it to the end. So there had to have been what we call a soft place to fall. So what was it that you remember that he found some restoration and some resilience and some comfort? That kind of, I always refer to it as a Psalms 91 place of restoration. He that dwells in the secret place. So what was it that you and, he, most importantly, and we'll talk about how the family came together in this thing.
Right. Well, I think that his solace was in God.
Mm-hmm.
My father was a deacon in the church. He's a lifetime Christian. And I think that he found his solace in God and knowing that in the end result, God was in control, not the doctors, not the nurses, not anyone else, but it was God who was in control.
Wow. So once that had all taken place, out of his passing, this wonderful foundation, we call it a foundation, but we know better. It's more than
well,
that.
this is ministry, and it is God sent. We're only 5 years old, but you wouldn't know that based upon the things that you see from us.
Absolutely.
And that let us know that God's hand is in this. His hand is in it from the beginning to the end. Another part of our conversation before, I was telling you, this cousin helped us with the graphics. That niece helped us with this, and that family member helped us with that. God just continually and constantly sends us exactly what we need when we need it. When we need it.
So, we'll talk a little bit more about the Elvin Howard Senior Pancreatic Cancer Foundation when we return, because you've got a lot of things that came out of that and continue to be a blessing to so many people.
A soft place to fall.
We were talking before we went to break about the foundation versus the ministry. So tell us a little bit about the birth of the Elvin Howard Senior Pancreatic Cancer Foundation and advocacy. I mean, there's a lot in there.
Absolutely. You know what? We struggled a little bit with that, whether or not we wanted it all in there, because we know that it is kind of a tongue twister. Elvin Howard Senior Pancreatic Cancer Advocacy Foundation, but I've said it a lot, so I have a lot of practice. But what we have done is the final 4 words are an acronym, PCAP. So Elvin Howard Senior PCAP, and we can kind of relate to that because my father raised cows.
Okay.
PCAP. Elvin Howard Senior PCAP is fine.
That's good. That's good. So 5 years now into it.
Yes.
And what I found interesting, and a lot of times my guests don't realize that what they're doing is in an effort to create a soft place for themselves. They may not label it as such. That you guys have actually created a soft place to fall for others. You've thrown a cushion to some of the others that may be dealing, or family member dealing with this. Tell me a little bit about how the foundation became more of a ministry.
Well, that's a very good point, Kerwin. And I think I could just start it this way. Right after my father's death, my mom, we collected money, donated money. We were going to donate it to the local Pancreatic Cancer Advocacy Foundation in his name. And one of my cousins, actually was Michael, the same doctor cousin, said, if you want to start a foundation, that would be good. And, my mom kind of threw around the idea, yeah, maybe I could start a foundation. So the idea just kind of kept bouncing around, throwing around, months turned into years, and we still hadn't done this thing. So my husband told my mom one day, well, Miss Howard, if you're going to do it, when are we going to do this thing? Let's go on and do it. And that was the impetus. She's like, you know what, we're going to do it. And we sat around my mother's dining room table probably a year or so planning out the foundation. What would its name be? What's the vision? What's the mission? What are we going to accomplish? What is it that we really want to do? And the things that we really wanted to make sure that we emphasize is awareness, number one. Awareness. Because normally if you just have a backache, I must have worked too hard. If I have a stomach ache, let me take a Tums. You know what I'm saying? If I'm tired, I need to go rest. If I lose weight, this is a good thing I'm losing weight, right? All of these things, though, when you combine them, is a sign. If you have weight loss, if you have pain, if you have a late diagnosis of diabetes. Diabetes is something that you normally are diagnosed with early. If you're in your 50s or 60s and you're all of a sudden being diagnosed with diabetes, I mentioned the weight loss. Sudden weight loss. Unexplained weight loss. You're not walking or exercising, but you have this tremendous weight loss. All of these things, when combined, can mean pancreatic cancer. You need to be aware of your body, be an advocate, go see a doctor right away. Okay. The other thing was advocacy. We need to get out there, right? We need to get out there. We need to put the word out. We need to have people pay attention to pancreatic cancer. Breast cancer didn't start off where breast cancer is now. Breast cancer started off with people beginning to advocate for themselves and saying, you know what, we need to, Ms. Coleman or whomever it was, we need to go out here and make people aware of breast cancer, and so that they can change the protocols. Now what? We all get yearly mammograms. Okay, all the women get yearly mammograms. So advocacy is very, very important. And one day, just like people know Susan B. Komen, we hope people know Elvin Howard Jr. Elvin Howard Sr. I apologize. Elvin Howard Sr. So that is what we're after. So we have awareness, we have advocacy, and then we have support. My mom was my father's caregiver, and we want to make sure that the caregivers are taken care of as well, because the caregivers take care of the person who is ill, and if they are not taking care of themselves, they can't adequately take care of the person that is going through the disease process. So those are our three tenets. We want to make sure we cover those. But we also want to make sure in our advocacy that we talk about some of the things that people may not always mention. Diabetes, and the fact that my father was diagnosed with diabetes prior to being diagnosed with pancreatic cancer. Why is it that the doctors and the medical professionals missed it? Because you're black, right? Let's call it what it is.
Exactly.
You're black, you're African American. They always have diabetes, right? So it's not unusual for them to all of a sudden, just jump to the easy answer.
So,
right?
So tell me, of all three of those, which has been the most challenging one? I would imagine bringing awareness, and because of what you just said, and why is it that is the first thing that doctors, I hear so many horrifying stories of misdiagnosis in a lot of these cases.
Well, I think that is a combination of things, and one of the things, it doesn't just affect the diagnosis of pancreatic cancer. Honestly, it affects so much, and that is those negative social determinants of health, right?
Yes.
We're talking about unemployment. I can't get to the doctor because I can't pay for it. We're talking about food insecurity. Not being able to get healthy foods and eating sugar and all the things that feed these diseases that may be in our bodies. We're talking about lack of health care. Not wanting to go to the doctor, not wanting to know what's going on with us. These are all things that are heavy and prevalent in the African American and other minority communities. It's prevalent among the poor.
Yes.
And so what we find is that pancreatic cancer and other chronic health diseases, we are disproportionately affected by these diseases.
And misrepresented.
And misrepresented. So you asked a question earlier about a ministry. That's why it's a ministry.
That's why it's a ministry. So we're going to talk a little bit more about that's why it's a ministry. And then you have something exciting coming up that we're going to talk about when we return to a soft place to fall. Are you covered, protected, and prepared? Don't you want to ease your mind by having the confidence that when the time comes, you and your loved ones are protected and insured? It's as easy as picking up the phone and calling licensed life agent Enidra Wells, 225-936-6017. With care and compassion, Enidra will walk you through the entire process of having you and your loved ones covered, protected, and prepared. No exams. Most pre-existing diagnoses are covered. No special requirements. So call today, 225-936-6017, and have the assurance of insurance.
A soft place to fall.
We went to break. We were talking about perhaps one of the biggest challenges in all three of those aspects of this wonderful foundation. And we mentioned, of course, awareness being. You brought up something even more prevalent, I would think. And what was that?
We were talking about, awareness, advocacy, and support. Advocacy. The mentioned earlier about Susan B. Komen and how 20 years ago you barely heard about, 40 years ago you barely heard about regular breast cancer exams. They got out there and they advocated. They pushed their politicians. They pushed the people who are working in the medical profession, etc. We want that same kind of push with pancreatic cancer.
Absolutely.
The bottom line is the reason why pancreatic cancer doesn't get the attention that it should, in my opinion, my humble opinion, is because of the demographics of the people who pass from it. And the more people like the John Lewises died of pancreatic, A.C. Hastings,
Yes.
pancreatic cancer, Alex Trebek, the more times we hear about these big name people who pass from pancreatic cancer, the better for us. Because, now all of a sudden we can pay attention to it, and we need to take advantage of the opportunity to put comprehensive policies into change comprehensive policies at the White House, at the legislatures, at these places that's going to help us now identify pancreatic cancer and these other chronic health diseases at an earlier time. Put in some screening. Let's do more diverse clinical trials, because it's funny. Clinical trials are generally white males, but yet those are not always the ones that get the diseases, right? So we need more diversity in clinical trials. We need to have clinical trials among people who are going to actually be getting these diseases, so we'll know the medications that work, we'll know the interventions that work among people who are really dying of those diseases.
We thank God for you and your foundation bringing attention to all of this. So you have something very special coming up that's going to encompass all of this and give us an opportunity to share all this information. What is it?
Well, let's talk. November is Pancreatic Cancer Awareness Month. And so that is our big month to advocate on behalf of pancreatic cancer. It's our big month to fundraise on pancreatic cancer, for pancreatic cancer as well. We understand that all of these things that we are attempting to do as a foundation cost money. And most of us who are working as board members or working as volunteers, we need to hire some staff so that we can do some of these things that we know need to be done. So we are having a fundraiser. Our fundraiser is always the second Friday in November. This year that will be November 12th. So on November 12th or November 12th, 2021 at 7 o'clock, we need you to turn on your smart devices, whether that's a computer or whatever it is. Go to Elvin Howard Senior PCAF.org and watch our live virtual fundraiser. This is going to be our 5th annual event, and we're so excited to bring this presentation to you. We're going to have some governmental officials. Representative Ted James is going to be on for us. Congressman Troy Carter is going to be on. We're also going to have Gary Anthony Williams. Some of you may know him as Mr. Ruckus on Boondocks. He's going to be on our show. We're going to have some very important information from our partners, national partners. Let's Win out of New York is going to have someone on that's going to talk about the importance of clinical trials. And also we're going to have a very important message from Johnson & Johnson, who's also partnering with us on the importance of diversity in clinical trials. So please come. You can watch it on our website, you can watch it on Facebook, or you can watch it on YouTube. It's going to be simulcast on the 12th at 7 o'clock.
Wow. That's a lot of great things coming out of that. And of course, we'll have all that information on the screen so that our viewers will be able to make sure that they don't miss this opportunity.
But a lot of great
let me just kind of throw back, because I always ask this question too, because obviously that takes a whole lot of work, and so y'all need some manpower. In the midst of putting all of this together and the passing of your father and all this, I would be remiss if I did not ask, how did you handle this whole pandemic thing? I asked all of my guests. Wow.
Yes.
I know I kind of threw you for a loop there, but
absolutely. But you know what? I think that, we're talking about God in the midst, right? God providing the path. We have a very important partner in WBRZ. As I told you, my dad worked at WBRZ right at 40. He retired at 39 years, right at 40 years. And so we have a wonderful partner in WBRZ that has been able to help us pivot where our fundraisers had been a banquet. And so now we've pivoted. Last year we did a virtual fundraiser in this format, and we're going to do that again this year in a virtual format. Still have some great, impactful speakers where you can learn some new information, where you can get that awareness that you need, but at the same time having it as a fundraiser where we can support the foundation and the programs that we do throughout the year. One of the things that we have not been able to do yet, but we hope to do very soon, is be able to provide our symposiums that we had been doing in the past. We have been doing symposiums twice a year, in the fall and in the spring, and so we want to get back to that. We will be having, however, a lunch and learn on November 30th with our partners, Les Wing Pancreatic Cancer, and if you tune into our program, you will learn more about that as well, lunch and learn, and look out for that as well.
Wow, that is incredible. And once again, I just applaud your family, because it all birthed out of the family, and the importance of that. But share for just one moment, if you will. I know that there's somebody out there watching and listening to what we're talking about. And fear happens to be one of the biggest things that holds people back. What would you say to someone who may be feeling some of these symptoms that you're talking about, or they notice it in their family? What would you tell them?
I think that the most important thing that any person needs to do is to be an advocate. Be an advocate for yourself. Listen to your body. Get the attention of a healthcare professional. Don't take no for an answer. You know, sometimes when we hear a good report, oh, you're fine, we'll say, oh, good, I must be fine. But they know inside they're not feeling fine. Be an advocate. Be proactive. Make sure that you get the medical attention that you need, so that you can really get the answers, so things will make sense. Not that just that you hear it, but you feel it in your body.
Absolutely. Well, we want to thank you once again for coming and sharing conversations here on the couch. We are so incredibly blessed to always find a soft place to fall and share information with our viewers. So once again, we're here on the beautiful grounds of Robert and Charmaine Torrey, and it's an incredible opportunity to come and share information that's going to help people, and more importantly, bring glory to God.
Absolutely.
So keep on doing what you're doing, and if there's ever anything that we can do to assist, please don't hesitate.
Thank you so much for having me this morning.
Well, we'll be back to wrap up another incredible edition of A Soft Place to Fall.
A soft place to fall.
Here's one of my most favorite segments in A Soft Place to Fall. It's an opportunity for me to tell of the good things that good people are doing. Opposite of what used to happen when you were a kid and you did something you had no business doing, and your siblings would always say, ooh, I'm gonna tell on you. Pretty much the same premise, but like I said, we're turning it around. We're telling of the good things. Now, we're in the midst of a pandemic, and we just came out of storm after storm after storm. So a lot of people were without the bare necessities of life. Dry clothes, a hot meal, toiletries. I met a young man who made sure that everyone in his community had everything that they needed to live a comfortable life as best as they could. He would see to them having a hot meal every day. He would see that they would have dry clothes every day and toiletries for their own personal use. And for that reason, Reverend Stephen Green, I'm going to tell God on you. I tell God on good people doing good things because I want God to bless them. And if you have someone you want me to tattle on, you can send me their contact information at asoftplace@yahoo.com, and I'll be sure and tell God on them for you.
A soft place to fall.
We want to thank thank our guest today, Veronica Howard Sizer. There was a lot of talk about pancreatic cancer, and November is Pancreatic Cancer Awareness Month. But in the midst of all of the other things that are going on during this pandemic, it is very important that if you're not feeling your complete self, go and get checked out. And don't leave until you get the proper answer. Thank you for joining us here at A Soft Place to Fall. I'll always encourage you, don't worry about what it looks like, feels like, sounds like. Press your way through whatever situation that you're going in. The Lord is in control. No matter how many mountains you successfully climb, how many goals you successfully achieve, how many initials you earn at the back of your name, are added there for your convenience. Remember this one thing, only what you do for Christ will last. Find your soft place to fall.
A soft place to fall. A soft place to fall.